What builds bone? So there's nutrition, it's hormones, and it's stimulus. The stimulus is anything that causes pressure on the bones. So that's why we say you have to do weight-bearing activity. Anything that builds muscle builds bones. Hello everyone, I am Dr. Nicole Smith, family nurse practitioner, orthopedic nurse practitioner, menopause board certified. I run a telemedicine hybrid practice here in Washington and Oregon State. And I am coming to you live from inside the hot box, which I know is always funny to see a menopause doctor cooking herself on purpose. But I don't have hot flashes yet. I don't know that I will get them. Mom did have them, so it's pretty likely I will have some. So I am a menopausal woman though. I get asked that a lot, okay, you're treating women like me, but are you like me? A lot of women prefer to go to another woman doctor. And there's a reason for that. I'm one of those too that kind of prefers that for female related things. We just get it. If you don't own the hardware, it's kind of hard to really understand fully what's going on with it. That's not to say that, men can't treat women and women can't treat men. I do treat men. I actually have male clients as well in the male hormone side of the practice that we focus mostly on women's care here, which is why you see that all over everything that we do here. But so I don't necessarily need to go through it to understand it, but there is just something about being in a woman's body and understanding the nuances of that. Men they have a different experience, and it's hard to really convey all of the stuff that we go through, right? So I do have a personal understanding of that. I started having symptoms in my late 30s and had a hard time finding help, which is amazing because I was like, I'm a provider and I can't find the help that I need. That's just crazy. That's crazy. So, did some more deep diving, talked to a naturopathic doctor, got myself straightened out, and I'm still working through it because I'm in my 40s. I'm in my mid 40s. I'm 44, and I'm still going through it. And things can change rapidly. Actually, I have a follow-up with a patient later on today who, looking back through her labs just from last year to this year, things are changing. So, and that can happen pretty quickly when we're going through perimenopause. So that can last anywhere from a year to 10 years or more. So it just kind of depends. And there are a lot of things influencing that too. Chronic stress, thyroid, gut health, all of the things. So we look at all of those things in my practice. We have an osteoporosis workshop coming up here May 9th, 10:30 a.m. is when it starts. It's going to run till about noon. We'll hang out longer. If you guys want to hang out longer, that's fine. We'll chat a little bit. Won't take up too much of the gym's time, though. It's going to happen over at CrossFit Unrestrained in Pasco, Washington. Thank you, Dana from CrossFit Unrestrained for hosting us again. We did another workshop last year with a couple other providers. This time it's just Dr. Desiree Lyle and I. Dr. Desiree Lyle is the founder of Race of Bar Physical Therapy. She does men and women as well as far as treatment is concerned, but she also specializes in pelvic health and loves her midlife women like I do. So it's hot in here today, guys. It says 100. Oh, it just went up to 124. It was 122. These are my electrolytes amino blend with creatine I take every day. So osteoporosis is such a huge area of need, just like menopause is, just like perimenopause is. When I was working in the hospital, and I've only been gone from that practice for a year, I went full-time into my own private practice, so yay. Pretty exciting, and I'm still here, so that's good. Going into private practice for any provider is very hard. It's rough out here, guys. There's a reason why there's fewer and fewer of us, and also why so many of us are cash pay only, because trying to deal with insurance is a sure way to just burn out and go under. It's not sustainable. So that's why we do what we do. Plus, then I get to spend the time with my patients that I want to. I'm not restricted by like, oh, we only get to talk about 2 things because that's all your insurance will cover. You got to make an appointment next month for your other thing that we need to deal with. No, I don't practice like that. We don't play that game. We're going to deal with all of it. Obviously, we're going to deal with the biggest things that we need to deal with right now because it can get very overwhelming, but we don't need to box ourselves in with just like 1 or 2 complaints per visit. Stupid. When I was working in orthopedics at the hospital, one of the things that I started specializing in was fractures and osteoporosis. And this is where some people ask me, like, where did the name Antigravity Wellness come from? It comes from that work that I did in orthopedics, kind of inspired by that, inspired by working with fracture patients, working with women, osteoporosis, and just the whole, like, we're fighting against gravity. Let's try and keep ourselves upright. We're fighting against gravity. We're trying to create the best quality of life that we can for as long as we can. And that starts early. We start losing bone mass at about age 30. We start building our best bone in menarche. So when we start menstruating, when we reach puberty, that's when our bones really start to pick up speed and start building. So the nutrition from that point and the input to the bones is very important from that point on. It's also important when we're growing children as well, right? What builds bone? That's a good question. What does build bone? There's so many components to it. So there's nutrition, it's hormones, and it's stimulus. The stimulus is anything that causes pressure on the bones. So that's why we have to do weight-bearing activity. Anything that builds muscle builds bones. So anything we can do to increase the resistance that our body is feeling, such as through progressive strength training, progressive overload, meaning we start with body weight and then we progress from there. We add bands, we add light dumbbells, we add kettlebells, we add barbells, we add machines are fine too. They all have their place, right? And you start where you are and you just get stronger. Walking is great, but walking is only going to get you so far. So if you're not even walking, let's start there. Absolutely. But then we're going to get to a point where it's like, okay, we're capped on our walking. We're talking anywhere from 7,000 to 8,000 steps, upwards of 10,000 steps. In the research, anything over 10,000 steps is the law of diminishing returns. Doing more doesn't get you more. And in fact, especially for women who have chronic fatigue and you're going through perimenopause and you're tired anyhow and you're not sleeping well, doing more is not better. It will backfire. It will actually cause you to have higher stress hormones running through your body, which will then take that belly fat and really store it and pack it on, which is not what we want. It causes a lot of other issues too. We're already starting to see our estrogen fluctuate and decline as we go through perimenopause. That hormone has a lot to do with how well we build bone, how well we build muscle, and how well our insulin is sensitization is. So less estrogen means more insulin resistance. And that is tied to things like more belly fat and increased risk for metabolic diseases, diabetes, heart disease, Alzheimer's, all of that. So what we do about it, we look at your hormones. Hormone replacement therapy, estrogen replacement therapy before bone loss is our number one treatment. 80% effective, roughly, depending on which study you look at. Incredibly effective, incredibly effective in combination always with lifestyle, diet, exercise, sleep, stress management. That has to be the foundation. Those are the 5. Got to be the foundation of everything we do. I don't care what hormone, drug, anything else we're doing with you. Those have to be the foundation of every treatment plan. That's what we really emphasize here. So we're going to talk more about that on May 9th at the Osteoporosis Workshop with Dr. Desiree Lyle and myself. I'm going to do more of the talking side of things and the medicine and the hormones and all that good stuff. And she's going to talk more about the strength training, resistance training, exercise component. And we're actually going to run you guys through a little bit of a exercise routine too. So it's an interactive workshop. I'm really excited. We've got some sponsors. So all the proceeds from this event, after everything is all said and done, are going to go to the Osteoporosis Foundation. So we're going to donate the proceeds. So it's not going to Desiree and I. We're not making any money off of this. We're doing this as, because we want to, because we have a passion for this and education and everything. So the proceeds will go to the Osteoporosis Foundation. We do have some sponsors that are starting to roll in. We're super excited. We're going to have gift bags for you guys. We'll have a door prize. At least one. It sounds like we might have two, actually. Somebody else is like, I'm going to donate a basket. We're like, ooh, that's going to be okay. Maybe we'll have 2 door prizes. And then we're going to have gift bags for everybody. So it's going to be like, Mother's Day themed, self-care, wellness, and that kind of stuff. So local small businesses. So if you are a local small business here in the Tri-Cities and you want to contribute a little bit of something, for example, Local Pumpkin is going to be donating like a little card and a honey stick, a local honey stick. So that'll be really cool. Jessica from Touch of Harmony Massage is donating a full massage certificate. So that's going to be one of our door prizes because that's a big one. And then we also have Sugar Bar is going to be donating. I think they're the ones who are actually going to donate another basket. So another one of our basket giveaways, if that's what they're doing. It sounds like that's in the works. Desiree's, also helping with this. So, yeah, fundraiser. Hi. And then somebody else just responded to that they might join in. So we're getting some sponsors in. We're really excited about that. So if you want to be a part of that, if this, these women who are, we have some women that are in their 20s that are going to come. They're going to bring their moms, bring your sister, bring your girlfriends, bring your partner. Like, it's not just for women. You can bring a guy if they want to come with. They are welcome. So we're selling tickets. If you look at the comments there, or the description here, Eventbrite is where you can get tickets. And there's a BOGO offer as well. So we definitely encourage you to bring a friend, family member, loved one, stranger on the street that you want to hang out with. Bring them, bring them all. And there will also be tickets available at the door. We're estimating capacity about 25 to 30. So there is limited room, but what, if more people show up, we'll just squeeze you in. There might be standing room. But it'll be really fun. I'm excited. So CrossFit Unrestrained, May 9th, 10:30 a.m., Mother's Day weekend. It'll be super fun, guys. All right, I gotta go. I got another appointment. I gotta get out of this hot box, have my protein bar post-workout, and then carry on with my day. All right, guys, I will talk to you later. Bye.